Today we are going to discuss about analgesics. Analgesic drugs are a classification of medications that reduce or eliminate pain, and some can reduce fever and inflammation also. They work by interfering with how pain signals are sent to the brain. So we have different types of analgesics. First, we see about opioids. The example of opioids are morphine and codeine. What are the functions of opioids? They bind to receptors in the brain and spinal cord, which cause changes in the perception of pain. When these receptors become activated, they release neurotransmitters, chemical that send signals from one nerve cell to another. This causes the body's pain-sensing neurons to stop sending pain signals back to the brain. It's important to note that they are not anti-inflammatory or antipyretic. These don't have any anti-inflammatory and antipyretic effect. Here are some list of opioid drugs: morphine sulfate, hydromorphone, codeine, oxycontin, oxycodone, phentermine. Opioid analgesics suppress pain impulses but can suppress respiration and coughing by acting on the respiratory and cough center in the medulla of the brain stem. So they can produce euphoria and sedation and can cause physical dependence. The opioid analgesics are mainly to treat mild to severe pain. The side effects and adverse effects are respiratory depression, orthostatic hypotension, urinary retention, nausea and vomiting, constipation. Now let us see the nasal care which we had to give to the patients. So we had to teach the patient deep breathing exercise to prevent atelectasis and pneumonia. IV to be given over 2 to 3 minutes, not over 5 to 10 seconds. Reassess after 15 minutes. If the patient is having respiratory rate below 12, we have to hold dose. Then if the patient become dizzy or lightheaded, assist them to a seated position. Do not let them get up unassisted because of the side effects of the drugs. If the patient may have orthostatic hypotension, then the patient may have CNS sedation. When the client easily falls asleep when talking, that means unarousable, then we have to understand the patient is having CNS sedation. Most of the opioids make the client act low and slow. Naloxone or Narcan is the antidote of opioid analgesics. So we have to give to the patient if the patient is having opioid analgesics overdose. This naloxone is having 1 to 2 hour half-life. So if the patient is having the respiratory rate below 12 and the patient is falling asleep, prepare the second dose of Narcan and notify the HCP. Phentermine is a potent synthetic opioid analgesics used to manage chronic and persistent pain, but not for acute pain. It works by binding to opioid receptors in the brain and spinal cord, which helps relieve pain by blocking pain signals from the nerve to the brain. Phentermine and other opioids can cause respiratory depression. So these medications should be used with caution, especially in elderly clients with chronic obstructive pulmonary disease, hypoventilation syndromes, or sleep apnea. Phentermine is also highly addictive medications. So what are the side effects of phentermine? The patient may have nausea, vomiting, dizziness, itching, dry mouth, sweating, trouble sleeping. So these are the side effects of phentermine. These are the examples of opioid antagonists. These opioid antagonists are used to treat respiratory depression from opioid overdose. Nursing interventions while giving opioid antagonist. Monitor blood pressure, pulse and respiratory rate every 5 minutes initially, tapering to every 15 minutes and then every 30 minutes until the client is stable. Place the client on a cardiac monitor. Ausculted breath sounds, we have to keep resuscitation equipment available all the time. Do not leave the client unattended. Monitor the client closely for several hours because when the effects of the antagonists wear off, the client may again display signs of opioid overdose due to a short half-life. Now let us see non-opioid analgesics. Under this, acetaminophen, aspirin, NSAIDs are. Now let us see non-steroidal anti-inflammatory drugs. These drugs are used to treat pain, fever, and inflammation. These drugs help to treat rheumatoid arthritis, bursitis, tendinitis, osteoarthritis, and acute gout. NSAIDs work by interfering with the production of prostaglandins, which are produced by the body as part of its inflammatory response to injury or disease. These prostaglandins are responsible for causing pain, swelling, and fever. NSAIDs are acetylsalicylic acid and acetylsalicylic acid-like medications that inhibit the synthesis of prostaglandins. These medications act as an analgesic, antipyretic, and anticoagulant. These NSAIDs are contraindicated in clients with hypersensitivity or liver or renal disease. Clients taking anticoagulants should not take acetylsalicylic acids or NSAIDs. Acetylsalicylic acid and an NSAID should not be taken together because aspirin decreases the blood level and effectiveness of NSAID and can increase the risk of bleeding. NSAIDs can increase the effects of warfarin, sulfonamides, cephalosporins, and phenytoin. Hypoglycemia can result if ibuprofen is taken with insulin or an oral hypoglycemic medications. If ibuprofen is taken concurrently with calcium channel blockers, a high risk of toxicity exists. The most common side effects of NSAIDs are nausea, vomiting, diarrhea, and bleeding in the stomach. Patients sometimes have blood dyscrasias, cardiovascular thrombotic events, decreased renal function, dizziness, dysarrhythmias, gastric irritability, hepatotoxicity, hypotension, sodium and water retention. Some patients may have pruritus and tinnitus. Nursing interventions. These medications are not the best for the body. If the patient is having any problem in kidneys, heart, asthma, GI, clots, MI, DVT or stroke, we should not give to the patient. In such patients, instead of giving NSAIDs, use acetaminophen. Instruct the patient to take these medications with food, never on empty stomach. Check for tarry stools and coffee ground emesis for bleeding. Avoid ego vitamins while taking these NSAIDs, such as vitamin E, ginkgo, garlic, and omega-3. After long-term use of NSAIDs, the patient may have dysfunctional kidneys. So ketorolac kills the kidneys. So we have to check for creatinine level. If the creatinine level is over 1.3 or urine output is less than 30 ml per hour, we have to stop the medications. No NSAID to the patient with congestive heart failure and hypertension. If the patient is having any such problems, we have to notify the physician. Next is acetylsalicylic acid or aspirin or ASA. The side effects of aspirin are tachycardia and hypotension and tinnitus. If the patient is having tinnitus, we have to notify the HCP. Avoid the patient with renal problem and Ray's syndrome. Ray's syndrome is swelling in brain and liver. Do not give salicylate containing drug bismuth subsalicylate or peptic bismol to the children with viral infections such as flu or varicella. Let us see the side effects and adverse effects of ASA. The patient may have allergic reactions such as anaphylaxis, laryngeal edema. The patient may have bleeding, anemia, hemolysis, increased bleeding time. Patient may have decreased renal function, dizziness, drowsiness, and flushing. Gastrointestinal symptoms such as distress, heartburn, nausea and vomiting, headaches, tinnitus, visual changes. Nursing interventions during aspirin administration. We have to assess for the history of gastric upset or bleeding or liver or renal diseases before administering the aspirin. Assess the patient for gastrointestinal upset during treatment. Monitor for edema. Monitor the serum salicylate level when the client is taking high doses. Therapeutic level of aspirin is below 100 mg per dl. We have to monitor for signs of bleeding such as tarry stools, bleeding gums, petechiae, ecchymosis, and purpura. Instruct the client to take the medication with food or milk. An enteric-coated or buffered form of ASA can be taken to decrease gastric distress. Instruct the client that enteric-coated tablets cannot be crushed or broken. Clients taking ASA should sit upright 20 to 30 minutes after taking the dose to reduce the GI discomfort. Advise the client to inform the healthcare professionals if they are taking high doses of ASA. If the patient is going for any surgery, discontinue 3 to 7 days before surgery to reduce the risk of bleeding. Instruct the client to avoid alcoholic beverages. Next, we see about acetaminophen. Acetaminophen is a type of analgesic drug that is used to treat pain, fever, and inflammation. It works by decreasing the production of prostaglandins in the brain and spinal cord, which causes an increase in pain tolerance and a decrease in sensitivity to temperature. It's one of the most common over-the-counter drugs, and it's generally considered safe for children when used correctly. Unlike other analgesics like aspirin or ibuprofen, acetaminophen does not affect blood clotting or cause stomach bleeding. This makes it an ideal choice for people at risk for bleeding disorders or stomach ulcers. Acetaminophen can cause liver damage or failure if not taken as prescribed or appropriately. So you have to avoid alcohol, so that can lead to toxic liver. Acetylcysteine is the antidote of acetaminophen. Topical capsaicin cream is used for temporary treatment for external use. Capsaicin helps treat neuralgia, a particular kind of a pain, shooting pain or burning pain in the nerves. Capsaicin is also used to treat minor pain from rheumatoid arthritis or muscle sprains and strains. These are the drugs which we use for the treatment of pain.